We are at Mount Carmel Care Center in Lenox, Massachusetts, speaking with the rehab manager here, Lisette Batrano. So, Lisette, tell me about the rehabilitation program at Mount Carmel Care Center. A lot of people know nursing facilities as, a sort of long-term care facility where people, spend the rest of their lives. But over the last couple of decades, that has changed drastically as to what kind of services are provided at skilled nursing facilities. So tell me about your program here.
We do short-term rehab here as well as long-term rehab. A lot of our short-term patients come here, and we really try to keep it very functional. We get the patients home as quickly as we can because we know that that's where they want to be. But we base a lot of our treatments on, what specifically that individual needs to safely make it home. Whether we work on home management tasks, we do a lot of occupational therapy. We'll work on ADLs, which is activities of daily living, which will include bathing, dressing, getting into the kitchen and cooking them a meal. We have a lot of patients that on Fridays, we will usually cook something like brownies or cakes, and then we eat it and enjoy it with the residents. So they really look forward to that. We also have a lot of modalities. So people that come in here that have chronic pain, we're able to offer them diathermy or ultrasound that can really help with that pain so that, upon going home, they don't have that pain anymore.
And having the right facilities is also very important. And I know Mount Carmel Care Center has upgraded significantly into a new rehab center that was finalized last year. It looks tremendous. So to be able to have the finest tools and the finest facility also makes a big difference.
It's huge. We have everything when we walk into that gym. It's set up just like a home. We have a functional kitchen in there. We have a bathroom in there where we can work on transfers and toileting. It makes it much easier for us to do our job when we have everything right there. And the patients love the gym. They come down there, and we try to make it a happy, fun place to be for the patients.
We're speaking with Lisette Batrano, who is the rehab manager at Mount Carmel Care Center. So, Lisette, tell me about how you got into this profession. You are an occupational therapist by your trade, as it were. So, tell me about your background.
I've been doing it about 19 years, and I've always liked to work with people. I've always been a people person, so I knew that I wanted to do something in the capacity of working with the elderly. I feel that I learn just as much from them as they do from me. And back in 1993, when I graduated high school, occupational therapy was the up-and-coming thing. It was kind of the new thing that people were getting into. So I figured, why not? And all 18 years that I've done this, it has been in a skilled nursing facility with the elderly, and I love it.
I think it's fair to say today it's also a profession that's in very high demand as well. Whether it's home care, whether it's long-term care facilities with the short-term rehab, or in acute care. I think physical therapists, occupational therapists. I can tell you, in changing economic times, that's certainly one profession that you can probably say to a young colleague that it's a good place to go.
Absolutely. And there's always room to grow. 18 years when I started this, I was a treating therapist, and I decided to become a rehab director 2 years ago. And it has its challenges, and sometimes I miss the one-on-one with the patients, but there's always room to grow in this type of work.
Well, Lisette Batrano, great pleasure speaking with you. We'll continue the conversation after